Dr. Christina Chester, and welcome again to our MCPS video series, Waymaking. Our goal is to help families make their way through many of the emotional challenges we are faced with today. I have with me today Ms. Cheree Price, who is a school psychologist in MCPS. Thank you for joining us today.
Thank you so much for having me, Dr. Chester.
Oh, absolutely. And so today we are discussing how attention deficit hyperactivity disorder, or ADHD, impacts our students. So for our first question, can you share with our audience, what does it mean to be a student with ADHD? How does this diagnosis impact students in our schools?
ADHD is a neurodevelopmental disorder that affects how people pay attention and control hyperactive and impulsive behaviors. It can be diagnosed at any age, including adulthood, and there are three types, which include inattentive presentation, hyperactive impulsive presentation, and combined presentation. ADHD is a diagnosis that is present in children of all ethnicities and socioeconomic backgrounds.
Oh, thank you. And so what are some of the symptoms of ADHD, and what are some of the things that students, families, and staff should be aware of when a student has a diagnosis of ADHD?
Yes, so as I just mentioned, there are three different types: inattentive presentation, hyperactive impulsive presentation, and combined presentation. Both the inattentive and hyperactive impulsive presentations of ADHD have 9 different symptoms each. I'm not going to go through all 9 of them, but I will talk about a couple of the more popular ones that I'm sure parents and students have probably heard of. For the inattentive presentation, having difficulty paying close attention to details, making careless mistakes, having difficulty organizing activities and tasks, also oftentimes losing things that are necessary for task and activities, such as school materials, are some of the most common symptoms of the inattentive type of ADHD. Now, the hyperactive impulsive type of ADHD, again, there are 9 symptoms. I'll talk about some of the more popular ones, often being very fidgety, tapping your hands or feet, or squirming in your seat, essentially having trouble sitting still, often talking excessively, blurting out answers before questions have been completed, and having difficulty waiting your turn are some of the more common symptoms of the hyperactive impulsive presentation of ADHD.
Well, thank you for that information.
Yes.
And so then my next question goes into, so what types of treatment are able to support, our students with ADHD?
Yes, ADHD is definitely a diagnosis that is treatable. According to research, the best treatments for it are a combination of medicine and therapy. But in schools, ADHD can be addressed a number of different ways for students. There could be eligibility for a Section 504 plan where you receive accommodations. There can be eligibility for special education services with an individualized education program, or IEP. And those are 2 different types of plans that students with ADHD can be eligible for. The accommodations piece we're looking at as a major life activity impacted. Usually with ADHD, thinking and concentrating are 2 major life activities that are impacted because of the diagnosis. So some examples of different accommodations that I've seen on plans for students with a diagnosis include extended time, preferential seating, having directions repeated and clarified, having your responses monitored, redirection, and breaks. And for an IEP, we're saying that a student needs specialized instruction in order to access a general education curriculum. So students with IEPs who have diagnosis of ADHD, and that is the biggest area of impact for them, they qualify as a student with an other health impairment. And you can see that their executive functioning skills can be addressed in a goal. Certain things of how they manage their self and their day can be addressed through that IEP.
Thank you for that information for our families, especially in terms of trying to provide some insight into, what is the process and what type of supports available if they have a 504 plan or an IEP, if their child has ADHD. And so my last question is, so do you have any suggestions or feedback for families and students to help them to stay resilient during this time?
Absolutely. I think definitely taking time for yourself and your family to spend time not always doing schoolwork is a huge way to stay resilient, and asking for help. If you are struggling with your symptoms of ADHD, whether it's in or out of school, know that there's always trusted adults that you can talk to about getting support and figuring out the ways to get that support. But I always tell families, take a break, go on a walk, get outside, move your body. I think it's always good to help making sure that you're taking care of yourself is the best way to stay resilient, especially during the times that we're in following the pandemic.
No, and thank you for that information. Yes, staying active is always important for everybody's well-being. And so we want to thank you, Cheree, for your time to be with us today. And we want to thank our viewers for joining us for Waymaking. To send us additional questions or topics to discuss on the show, please visit the link on your screen. Also, please go to our YouTube playlist to find additional shows in our series. And please join us next time for MCPS Waymaking.